This is more of information for an education for some of you. So, who are interested in it, that is. So, I I have had uterine fibroids for years, since in my 20s. And of course, I was still able to have children. They didn't cause me any problems until a little bit later in life. So, um, I they really started giving me a hard time in the last 2 years. So last year, I decided to go ahead and have a hysterectomy. Well, after the hysterectomy, um, I started having some pains. Probably about 8 months after the hysterectomy, I started having abdominal pain. And I talked with my doctor. He was my GYN. He was more than sure that it was probably adhesions, abdominal adhesions. Now, just to let you all know, for those of you who don't know, abdominal adhesions is scar tissue that develops, um, and normally your insides or your intestines, your organs are nice and slippery so that they can move around easily. Well, in your abdomen, once your abdominal cavity is opened and it's exposed, then that scar tissue will develop just like a scar on the outside. It can develop on the inside, and they look like little bands. There's some videos on YouTube about an actual video how they perform the laparoscopic procedure, which is the procedure that I had. Well, they take this tool, this camera, and they go inside and they kind of take a look with this camera and they insert it. I had 3 incisions, one into my navel, one in my lower abdomen, and then one on the side. And so, of course, he went in and he removed the adhesions. I had quite a bit, according to the information he shared with my significant other. What I was surprised about is, and just to let you know some of the symptoms that I had, other than the abdominal pain, I had periods of just violent vomiting and using the bathroom a whole lot. And it just gotten to the point where it was just unbearable. The pain was unbearable. And you just never know what's going on the inside of you. So I felt it was time for me to find out what was going on. Nonetheless, he also had to remove, when I had my hysterectomy, I only had my uterus removed. I did not have my fallopian tubes removed, and my cervix was removed as well. So, and I kept my ovaries. So, apparently, when he went in, he removed my fallopian tubes this time, and he also removed my appendix. He informed my significant other, that is, that he doesn't like to talk to his patients right after the surgery because they're not coherent, which makes perfect sense. So I can't wait to talk to him next week and find out what was going on with my appendix. I have a feeling that I was also experiencing, I probably had an appendicitis, and that would explain the nausea and the vomiting. So it's so crazy. You never know what's going on the inside of you, and you never know what's going on in somebody's life. But I trudge forward, and I'm recovering now. I did make the conscious decision to go ahead and have this done after it was just to the point where I couldn't stand it anymore. But my purpose in saying this is to just educate you all on the procedure. I'm open to questions. My recovery is going great. I'm just taking it easy for the next couple days. But for those of you that have uterine fibroids and that are considering having a hysterectomy, I still say the hysterectomy was the greatest idea because I mean, along with not having a menstrual cycle, I just feel a whole lot better. Adhesions it's just kind of one of those things that just comes along with the territory. And to be honest with you, I could develop them again. It's no guarantee that they won't come back. It just comes along with the territory. So I wouldn't trade having the hysterectomy, but I would say that my diet is probably going to change even more. My eating habits have changed quite a bit, and I feel better, but at the same time, this is kind of a new era for me as I am getting older. And so for the most part, I feel like I made a great decision, and don't ignore those symptoms and those signs that you may have yourself. I think that's all I want to say. So you all take care. Thank you all for checking on me, the ones that have. I do appreciate it so much. But I'm good. I'm great. I'm great. You all have a great day. Take it easy.